when I first started working with clients, I thought food sensitivities and then SIBO were the causes behind IBS. And that was not the case for my clients. And then I learned a ton because I would be like, oh yeah, it's this thing. This is what the research says. And they didn't have SIBO or they didn't really have food sensitivities. And so I ended up finding out about enzyme deficiencies, for example, pancreatic enzyme deficiencies and various different other drivers like food additives that can really create digestive distress, different infections.
Yeah.
And I was waiting for somebody else to write the book about irritable bowel syndrome.
Yeah.
Stress is, of course, a contributor. But when you look at the market right now, a lot of the books focus on stress reduction or they're books entirely on SIBO.
Right.
And I think these are all important root causes and drivers. But the truth is, IBS is an umbrella term.
Right.
And there can be 20 different causes behind it, 20 plus different causes.
Right.
And so my very light read 500-page book details all the different root causes.
Thousands of references.
With thousands. The references are on the website because I couldn't even print them in the book. But it details all the different root causes and drivers, how to test for them, how to figure out which might be an important driver, and then what to do about each.
Yeah.
So if you have, for example, IBD, this is oftentimes something that is diagnosed as IBS. Right. For many years, people will have IBD, but they have the IBS diagnosis. Right. That needs to be approached differently than IBS from a conventional standpoint and even IBS from a functional standpoint.
Yeah.
And so I have a whole protocol on what to do if somebody has IBD. I guess the second reason I wrote this book is because my husband was actually diagnosed with IBD right after our son was born. Our son was like 2 weeks old, and we were at the GI doctor. He was getting a colonoscopy to figure out what was going on. And at the time, we were living in Boulder, and I had these 3 wonderful friends, Dr. Jill Carnahan, who you know, my friend Debbie Steinbach, who's a nutritionist, and Steve Wright, who is my gut guru. He's a good friend that has a gut supplement company. And the 3 of them, along with my recent IFM training in gut, helped me put together a plan to get my husband into remission within a few weeks.
Yeah. So he developed inflammatory bowel disease.
Ulcerative colitis.
Yeah.
Yes. It was quite scary. And it kind of came out of nowhere. Part of me was like, well, this is not like thyroid, so I don't know what to do.
Right.
And then our primary care doctor was like, well, Izabella, it's actually very similar to what you would do for thyroid. And then we figured out a pathway to get him into remission from that. I see so many people all over the world, and they've had IBD for such a long time, and they're
like
using heavy-duty
years
meds
or something. Yeah,
20 years, and they're having increased risks for colon cancer, and they're having to have parts of their colon removed.
Yeah,
and there is some straightforward protocols that can be utilized, like the semi-elemental diet, can be incredibly helpful and healing.
Yeah.
And there are also things in functional medicine that need to be avoided. For example, berberine can cause more inflammation for people in the active states of IBD.
Interesting.
And so that is why I decided to write a 500-page book about irritable bowel syndrome, because there's so many things that clinicians need to know, as well as patients need to know when they have that label diagnosis.
Right. What surprised you the most, like in your research? What things did you find that you were like, wow, I had never thought of it this way, and it is a game changer?
One thing that was really interesting for me is there was a study done by Dr. Haba in 2011 of 303 people, and he found these people were diagnosed with IBS. 98% of the time, they had treatable causes. So whether that was celiac disease or pancreatic exocrine insufficiency.
Because that's very underdiagnosed.
Yeah.
Yeah. Yeah.
So that's been very, very fascinating to me, that there is always a cause, and there are so many different causes that were just not necessarily even on my radar when I went through the literature review. Right. I mean, I'm a big proponent of, you want to look at your medications too, being a pharmacist.
Yes.
When I was in pharmacy school, if there was ever a multiple choice question about which side effect this drug caused, the answer was always GI upset, right?
Right.
So just really being able to look at that is going to be really relevant. And then I think another thing that I didn't realize is all of the food additives. Maybe I did realize it, but I didn't just appreciate the impact that food additives erythritol
Yeah.
and sorbitol and all
Right.
of the, I mean, some of them act as osmotic laxatives in
Right.
large doses,
Right.
how they could really impact our gut health and IBS.
Wow.
And then another thing, birth control pills.
Yeah.
So birth control pills, specifically drospirenone containing birth control pills, have been found to increase the rates of irritable bowel syndrome.
Wow.
And I hadn't realized that. I mean, I used to dispense Yaz and Yasmin like it was
That
candy
was
on a
like
daily basis.
very popular in the late 90s, early 2000s.
Absolutely.
Yeah.
It's
And
one
a
of
lot
the
of people use it for acne too.
they used it for acne and then it had this diuretic effect.
Yeah.
So a lot of women preferred it over other birth control
Right.
pills because it helped them lose a little bit of weight.
Yeah.
Versus the other birth control pills kind of made people a little bit more bloated.
Right.
And so it was super, super popular. And yet I think about how many young women ended up with taking birth control
Yeah.
and then getting IBS
Yeah.
and then getting a thyroid condition or other autoimmune condition. We do
And nutrient depletions.
all the nutrient depletions, right? All of the gut inflammation. I know that when I went to my first IFM training, one interesting thing they mentioned was that people oftentimes get IBS 5, 10, or 15 years before an autoimmune diagnosis.
Wow.
This is certainly the case with
Yeah.
me and a
Yeah.
lot of my clients that I've done a history on.
Yeah.
I always ask them, what was going on in your life
Yeah.
the last time you felt well, and what other kind of conditions have you had? And when we look at their health timelines,
Yeah.
you can see many times IBS came before the autoimmunity.